Welcome to this explainer. Today, we're diving into an absolutely fascinating paradigm shift in modern medicine, taking viruses, our traditional microscopic enemies, and reprogramming them into targeted allies against cancer. For decades, we've thought of viruses strictly as pathogens to be eradicated. But today, we're going to unpack the science of how researchers are turning them into sophisticated, tumor-destroying machines. Now, what if the cure for cancer is a virus? Sounds totally like science fiction, doesn't it? Intentionally infecting someone with a virus to heal them. But as we dig into the research today, you'll see exactly how this biological judo works, literally using the disease's own vulnerabilities right against it. Here's our roadmap for today. We'll meet the cancer-killing viruses, see exactly how they work, check out current approvals and trials, review the safety profile, explore combination therapies, and finally, peek into the future of virotherapy. Okay, part 1. Meet the cancer-killing viruses, a totally new paradigm. So, unlike traditional non-specific chemotherapy or radiotherapy, which we know can unfortunately damage both healthy and malignant cells, these viruses are incredibly precise biological weapons. An oncolytic virus is one that's either naturally selected or genetically engineered in a lab to specifically target cancer cells. Because cancer cells have these mutated signaling pathways and often defective antiviral defenses, while the viruses can easily slip inside them. And the best part? They leave your healthy, normal tissue completely unharmed. Moving on to part 2, how oncolytic viruses work, the Trojan horse. This perfectly illustrates the dual-action attack that makes these viruses so wildly effective. Step 1, the virus infects the tumor cell. Then, step 2, it literally hijacks the cancer cell's own genetic machinery to aggressively pump out copies of itself. Step 3 is direct lysis, meaning the virus bursts that cancer cell wide open from the inside out, destroying it completely. But step 4, that's where the real magic happens. When that cancer cell bursts, it releases tumor-associated antigens and danger signals. It's basically like shooting off a biochemical flare gun. It wakes up your body's own immune system, turning it into the ultimate hunter to systematically track down any remaining cancer cells throughout your body. Let's look at part 3, approved therapies and trials, from the lab to the clinic. Now, this science isn't just theoretical anymore. There's massive global momentum here, and it's already helping patients. Just look at the timeline. Back in 2004, Latvia approved Rigver for melanoma. Then, in 2005, China approved an engineered adenovirus called H1N1 for head and neck cancer. A really major milestone hit in 2015, when the US and Europe approved T-VEC, which is a modified herpes virus for advanced melanoma. And most recently, in 2021, Japan approved Delytact for treating glioma, a super aggressive type of brain tumor. We're literally seeing different countries globally approving distinct engineered viruses for highly specific cancers. And beyond the approved list, ongoing clinical trials are showing absolutely incredible promise. Take Telomelysin, or OBP301, for example. This is an investigational oncolytic adenovirus, and it's been modified with a human telomerase promoter so it only replicates in cancer cells. In a clinical trial over in Japan evaluating its use alongside radiotherapy for esophageal cancer, 8 out of 13 patients showed a complete response. Let that sink in. The tumor completely disappeared in those 8 patients. They also saw a huge increase in cancer-fighting T cells infiltrating the tumor area. For researchers, seeing this kind of response is a massive optimistic leap forward for treating really tough gastrointestinal cancers. All right, section 4, side effects and safety, grounding the science. As pumped as we are about these clinical successes, we've got to realistically address the safety profile here. While it's significantly more targeted than traditional treatments, you have to remember, the body's natural response to a viral infection means patients commonly experience flu-like symptoms. You might get chills, a fever, fatigue, or nausea, plus some pain right at the injection site. Which makes perfect sense, right? Your immune system is actively reacting to a virus. But doctors do have to carefully monitor for an overactive immune response. There's a rare but severe risk called cytokine release syndrome, or CRS. That happens when the immune system gets way too revved up by the systemic activation, causing widespread and potentially dangerous inflammation. Moving to part 5, teaming up, combination therapies. Okay, so while virotherapy is definitely strong on its own, it acts as a massive force multiplier when combined with other treatments. For instance, when you pair it with radiation therapy, the virus can actually make the cancer cells way more sensitive to the radiation. But the absolute most exciting synergy is with immunotherapy. See, many tumors are what we call cold. They just hide from the immune system. Oncolytic viruses burst those cells open and release those danger signals we talked about earlier, basically turning the tumor hot. And once the tumor is hot and the immune system is paying attention, drugs called immune checkpoint inhibitors can swoop in and stop the cancer cells from turning the immune system back off. It's a phenomenal 1-2 punch that overcomes traditional tumor resistance. Because of this incredible synergy, researchers are actively rewriting the playbook for advanced cancers right now. A perfect example of this? There's a current global phase 3 trial pairing the approved oncolytic virus T-VEC with the blockbuster immunotherapy drug Keytruda. By using the virus to bust open the melanoma cells and Keytruda to totally take the brakes off the immune system, researchers are hoping to lock in much higher, much more durable response rates than either therapy could ever pull off alone. And finally, Part 6, the future of viral therapy, the next frontier. Looking ahead, as highlighted in a recent 2026 review in Signal Transduction and Targeted Therapy, researchers are rapidly working to overcome current hurdles. A big one is systemic delivery. Right now, a lot of these viruses literally have to be injected straight into the tumor. So scientists are working tirelessly to engineer viruses that can be given via a simple IV drip, survive the bloodstream without getting cleared by your immune system too early, and then home in directly on metastatic tumors anywhere in the body. We're also seeing this major shift from a one-size-fits-all approach to true personalized medicine. Just imagine a future where doctors take a biopsy of your specific tumor, grow a mini version of it in the lab, what they call a patient-derived organoid, and then actually test different viruses on it to see exactly which one works best for you. Or what about using CRISPR-Cas9 to precision edit a virus, literally custom building it from scratch using synthetic biology to perfectly target an individual's unique genetic cancer profile? The integration of these advanced tech tools means the oncolytic viruses of tomorrow are going to be exponentially smarter than what we have today. So as we continue to decode the immune system and truly master genetic engineering, I want to leave you with this final thought. The microscopic enemies that have plagued humanity for millennia, causing countless diseases, are right now being reprogrammed into the very allies that could help us conquer cancer. It's a beautiful twist of biological irony, isn't it? And it's happening right now in labs and clinics all around the world. Thank you for joining me on this explainer. Keep questioning, keep learning, and I'll catch you next time.